all of you. Thank you very much for the invitation. In fact, maybe not a very good luck to have this topic. It seems a difficult topic. That's why I'll try to make it a little bit easier step by step. First of all, I divided this into 3 by 6, with 6 C's and 6 hemodynamic parameters and 6 pumps. The 6 C's of the veins are the capacitance, compliance, competence, coagulability, and complicated. I mean, the hemodynamics are much more complicated than the arterial ones. Controversies, of course, because there are many things of the hemodynamics are not well agreed by all workers. Let's have a look also at the hemodynamic parameters. The most important are the 3 to one side: the flow, the volume, pressure. These are the most important. Then comes the velocity, viscosity, and resistance. As a start, I want you to see this slide. This is the things that agreed upon by all the workers, that the flow is inversely proportional to the resistance. The more the resistance, the less the flow, of course. And flow is actually the result of the pressure gradient over the resistance. And the venous return, which is actually normal, under normal conditions, is the same as the cardiac output. And this venous return, or the flow, means the venous pressure minus the right atrial pressure divided by the resistance. This is the same as the pressure gradient, venous pressure minus the right atrial pressure, which is around 0. Velocity is inversely proportional to the total cross-sectional area. This also can be understood if you have a capillary bed, for example, very, very, very huge in area, we'll find that the velocity is less. Velocity increases with the decrease in diameter. These are the principles which are agreed by all the workers. I'll skip this slide and come to the blood flow to make it just to the point. Blood flow, as we said, is a pressure gradient divided by the resistance. Resistance is also related to many things, most of which is the length of a tube. Even junior doctors, if they use a long catheter, will find more resistance to flow. The shorter catheters are lesser resistance, and also the diameter of the. So the equation of the flow is called Poiseuille's equation. It means that the rate of the flow is dependent on the pressure gradient, radius, length of the vessels, and viscosity. Most important thing that we are surgeons concerned with the laminar flow, and we will see now laminar flow is that I'm sorry for that. I'll come back. الكمبيوتر سمعت area assistance. Shift فين؟ this slide. This slide. Yes. لا خليك انا كده بس. ابدا انا منين بقى كده؟ I'm sorry for that. Laminar flow and turbulence flow are the 2 most important things to consider later on. Turbulence is dependent on at least 4 factors. The diameter, change of the diameter, and is the most important. We all know that any change of the diameter of the vessels will make the turbulence, and this is dependent on the diameter change as well as the velocity, viscosity, and density. Most important that the viscosity is expressed by the Bernoulli equation, and the whole turbulence factor is sometimes expressed in all these variables in the so-called Reynolds number. The more than 2,000 Reynolds number mean that on the verge of turbulence. Resistance to flow is dependent, as I told you, about the vessel length, radius, and viscosity. It can be understood that the more the viscosity, the more the resistance, and the vessel radius, if it's more, is a less resistance, and the vessel length is more vessel dense, means gives more resistance. What controversies actually here is that what's the role of the sympathetic system? It's of academic interest more than clinical interest. What's the role of the venodilators? It's also of academic more than surgical or clinical interest. Let's come to the pressure. This is a very important point. The pressure, where I'm standing now, there is hydrostatic pressure with the gravity, and then transmural pressure, a pressure exerted on the walls of the vein, and the whole resultant of these two pressures is the dynamic pressure, which is actually the actual pressure which is will be effective. Most important point that when we stand, we have very high pressure in the foot, which is about 90 millimeter mercury, and we have the zero pressure in the atrium, and this is a very good gradient. This is the pressure gradient, and the expression of this pressure is agreed upon about the so-called mean systemic filling pressure. It's a certain equation that calculates the gradient between the pressure in the foot and pressure more proximally. And the venous circulation has a very high volume. It's a higher volume, low pressure system. It's very important that to know there's a pressure volume curve. Veins have the very important point. They can accommodate large volumes of blood without concomitant increase of pressure. The capacitance is part of it, and compliance is part. Capacitance means they can expand. Compliance, they can expand without increase in the pressure, and the curve is very clear. It is a vertical limb in the pressure, and the other thing is that the veins can change their shape. I mean, when they are low pressure, they are collapsible, but at the highest pressure, they are circular in cut section. Very important also to remember that the venous pressure decreases with exercise. This is quite agreed by all. And the ambulatory venous pressure is that can be expressed with some exercise. It decreases much from 90 to 30 at least, or less than this. And an important parameter of the chronic venous insufficiency is the failure of the patient to decrease the pressure on ambulation. Let's speak about the pumps. There are 6 pumps. The heart, as you know. Diaphragm, you know that the negative pressure exerts a sucking effect on the venous artery. The foot pump, we'll speak about soon. Superficial venous pump from it's rather recent, or 2018, described this pump. We'll speak soon about this. And the calf pump, as you all know, is the most important pump. The thigh pump, and the direction is governed by the valves. Let's speak about the calf pump. It's the most important calf pump. I will not go much, except that the most important, and we can study this by the plethysmography. Plethysmography has been a very old thing since decades, and now there is a revival of interest and renovation of interest, and the cuff pump as a heart, peripheral heart, has also as an ejection fraction and residual volume fraction. We'll see right now. We can measure the ejection fraction. Normal is 20%, and the residual fraction, and all this can be recorded by recent methods, by the Bluetooth methods, computerized methods. But anyhow, it is a revival of the very, very, very old investigation, which is a precisionography. Now about the foot pump, because many people do not realize, this pump, it is a pump, although there is no much strong muscles. But the fascia is very strong and encloses the veins, and with movement, especially, this increases the venous return very much. This is the evidence of that comes that
2 minutes more, please.
There are devices which use a foot pump. This is evidence that foot pump is important. These devices enhance the venous return and are used as anti-DVT agent. This last pump is that the vein is enclosed between the saphenous fascia and the fascia. The great saphenous vein, with movement, the saphenous fascia and the deep fascia come together, as you see the arrows, and they exert a pumping effect of movement, and this has been described in 2017 by a Russian worker. Valves, as you all know, they allow one direction, but the controversial issues, why are there valves in extremely tiny venules? And the controversial issue, the last one, is the importance of the great saphenous vein. The message, the pressure, and remember, see that.
شكرا للدكتور كوراشي.